Hello, welcome to my video. I'm Dr. David Ngoma, and we'll be discussing anemia. So let's begin with the outline. So we'll look at the definition, the causes, symptoms, classification of anemia, how to make a diagnosis, the treatment, as well as prevention of anemia. So to begin with, what is anemia? Anemia is a condition in which there's a decrease in the number of red blood cells or hemoglobin, leading to reduced oxygen delivery to tissues. So as we know, the function of red blood cells which contain hemoglobin is to transfer oxygen to tissues from the lungs, as well as to carry carbon dioxide from the tissues to the lungs. Now, what are the causes of anemia? Anemia can result from three main things. So if you forget the causes, at least if you remember the three main things that can happen so that a person has anemia. So the first one is decreased red blood cell production. The second one is increased red blood cell destruction, also known as hemolysis. And the third one is hemolysis. So as you can see, all these are causing a reduction in red blood cells. So some of the causes of a decreased red blood cell production include iron deficiency anemia, which could be from poor diet or chronic blood loss, vitamin B12 or folate deficiency, bone marrow failure, as in plastic anemia, which we'll discuss in a later video, as well as in leukemia, which is cancer of the red blood cells. The anemia could also be caused by increased destruction, also known as hemolysis, from sickle cell disease, which causes sequestration of red blood cells and leading to their destruction. There's also a genetic condition known as glucose 6-phosphate deficiency, autoimmune hemolytic anemia. As the name suggests, autoimmune, it means the body is attacking its own tissues. In this case, it's targeting the red blood cells, leading to hemolysis. Also, blood loss from gastrointestinal bleeding, as in hookworms or ulcers, or even trauma like from a road traffic accident, or if there's any bleach in the blood vessels. Some of the symptoms of anemia, so we can classify these. There are the non-specific symptoms, which include fatigue, weakness, dizziness, fainting. We call them just general because they can actually present in several other conditions aside from anemia, so they're not necessarily specific. But some of the most sensitive ones include pallor, especially when you have palmar-pallor or conjunctival pallor. Sometimes in severe cases it might actually appear paper white, suggesting that there is reduced red blood cells in the tissues. And there could also be jaundice, suggestive of hemolytic anemia. A patient can also present with shortness of breath and a rapid heartbeat because the body is trying to compensate for the reduced oxygen supply to the tissue, so it's trying to pump harder. And also the respiratory system is trying to breathe in more oxygen so that it can supply the starving tissues. Neurologically, the patient can present with irritability, poor concentration, which is common in iron deficiency, and they could also present with growth issues, such as delayed growth and development in chronic anemia. Anemia can be classified in several ways. So this is classification according to MCV, which is the mean cell volume, which just means it's like the average size of the red blood cells in a sample. So this can tell you like the suggestive causes. For example, if the MCV level is less than 80, we measure this in femtoliters, that is called microcytic anemia. And some of the causes include iron deficiency, thalassemia, lead poisoning, and the key features are usually the patient presents with pallor, pica, which is craving of non-food items. Patient might be seen craving sand. They can also present with peritonitis. Normocytic anemia is when the MCV is within the normal range, within 80 to 100 femtoliters, and the causes include acute blood loss, chronic disease, hemolytic anemia. So as we know, one of the major contributors to the production of red blood cells is the hormone known as erythropoietin, which is produced in the kidneys. And in chronic kidney disease, a patient might have a reduction in that hormone, so that could cause anemia. The key features when you view the red blood cells under the microscope, they're normal sized red blood cells, but the patient may have jaundice if it's hemolytic anemia. And then the final one is macrocytic anemia, where the MCV is greater than 100 femtoliters, and the causes include vitamin B12 or folate deficiency and bone marrow disorders. Key features include enlarged red blood cells, glossitis or swollen tongue, and neurological symptoms in B12 deficiency. For you to make a diagnosis of anemia, there are several tests you can do. The first one is a full blood count, which measures the hemoglobin, hematocrit, as well as red blood cell indices like the MCV and the MCHC. You can also just do a peripheral blood smear to examine the size of the red blood cells, the shape, as well as if there are any abnormalities. Reticulocyte count, which assesses bone marrow response, because reticulocytes are actually just immature red blood cells. So sometimes if there isn't sufficient red blood cells, bone marrow compensates by producing a lot of blood cells, and you might end up finding an increase in these immature red blood cells. You can also perform iron studies, including serum ferritin, iron total iron binding capacity, just to assess for if the patient has microcytic anemia and you want to rule out iron deficiency and anemia. You can also perform hemoglobin electrophoresis, which identifies that's a mouthful of a word. Hemoglobinopathies, which include sickle cell disease and thalassemias. In other cases, you can perform a bone marrow biopsy if bone marrow failure is suspected. For the management, so as I've mentioned, there are several causes of anemia, and the management is based on the cause. So you manage the cause. For mild to moderate anemia, if you're thinking that the anemia is caused by iron deficiency, then you can supplement iron. If you think it's vitamin B12 or folate deficiency, then you can also supplement these. If the patient maybe has anemia secondary to intestinal worms, then you can deworm. And for severe anemia, despite maybe not having identified the cause, if the hemoglobin level is less than 4 or it's between 4 and 6 grams per deciliter and it's symptomatic, then you must perform a blood transfusion, especially in severe hemolysis or acute blood loss. And you can also give erythropoietin for anemia of chronic disease, bone marrow transplant for conditions like aplastic anemia. Prevention of anemia includes iron-rich diets. So if your diet includes meat, green leafy vegetables, legumes, fortified cereals, routine deworming to prevent hookworms, hookworm-related anemia, because hookworms can puncture the intestinal lining, leading to blood loss and thus anemia. Malaria prevention, use insecticide-treated bed nets. Malaria is one of the most common causes of anemia in the sub-Saharan region because it actually causes hemolysis. Vitamin supplementation in populations at risk of folate or B12 deficiency, so you can actually supplement these vitamins. So this is it for this video. I hope it makes sense. If there are any questions, please drop them in the comment section, and I'll see you in the next video.